Are people excited to be here tonight?
Yeah!
We are excited to be here with all of you as well. We want to thank you for joining us tonight. This town hall is one of 3 town halls that have happened this month on CalCare around the state of California as a part of the statewide CalCare tour organized by the California Nurses Association and CalCare office up in Carrillo. I also want to shout out a few of the local organizations who are co-sponsoring tonight's event, and some of them are outside tabling, so if you haven't stopped by and signed up with them, make sure to do that after the event. But we have Hollywood for CalCare, we have Single-Minded for Single Payer, we have CalCare for Us, API for CalCare, and we have the Bern Democratic Club. So give them a round of applause for all of them. So, my name is Max. I'm an organizer on the CalCare campaign with the California Nurses Association. I'm just going to be helping to MC tonight's event and helping to moderate our panel. So let me just give you a quick sense of what to expect today. In just a minute, I'm going to hand things over to Cathy Fairbanks, who is a local RN at UCLA, a proud member of the California Nurses Association. Cathy is going to help kick things off and, remind us why nurses are so committed to passing CalCare and to winning healthcare justice. She's also going to give us an idea of some of the core pillars of what CalCare is, so that we can ensure that we're all on the same page tonight. After that, I'm going to give a very, very quick presentation on the 5-part plan to advance CalCare this year, some of the stuff that we've been working on as a movement over the year of 2023. From there, we're going to move into the main portion of tonight's event, which is a moderated conversation with some of our elected leaders who are part of our panel today. And collectively, these 3 members of the Assembly represent over 1.5 million Californians. And we're very honored to have them here tonight. And we're going to hear more from them in just a little bit. But for now, let me just very briefly introduce them, and then they will also be introducing themselves before they speak. But we have Assemblymember Kalra with us. Woo! And I mentioned this earlier, but Assemblymember Carrillo is the author of CalCare, AB 1690 in the Assembly. We're organizing these town halls in coordination with the Assembly member all across the state. We're grateful to have him here with us today. This is actually, again, his 3rd town hall that he's participated in, so we're grateful for that. We also have Assembly member Wendy Carrillo. Just to give you an idea of what part of LA that is, it's the city, part of the city of Los Angeles, South Glendale, so that's just northeast of where we are tonight. And Assemblymember Carrillo was one of the principal co-authors of CalCare in the last legislative session. So we're grateful for her work and for her joining us tonight. And last but not least, we also have Assemblymember Miguel Santiago representing includes Boyle Heights, downtown LA, Koreatown, which is where we are right now, Pico Union, and some of the surrounding areas. And Assemblymember Santiago was one of the lead authors of CalCare in the last legislative session. So, after that conversation, we're going to pause for a minute. So I'm going to ask my panelists not to run quite yet. I'm going to have a very quick update of where the campaign is today. I'm going to have a campaign ask for all of you to take and to plug into the campaign. That's going to take like 5 minutes. And then the final portion of the event, we'll have some time for Q&A. So during the panel, you may have grabbed these on your way in, but we have index cards, so you might want to have an index card with an old pencil with you in case you think of a question during the conversation tonight. You can fill that out, and then we'll be collecting those before the Q&A section. So if you need one, they're outside here on the table, so make sure to grab that. But thank you everybody for being here tonight. This is going to be a great discussion, I think. And I just want to end with the goal of tonight's event is to not only facilitate a community discussion on the need for healthcare justice in our state, but to also hear, from our elected leaders, hear some of their thoughts on why single payer is the right policy, what it will take to win, and also some next steps in the campaign, right? All of you should leave here today with a very clear idea of how you can take action to advance CalCare. And the current plan is to advance CalCare in early 2024. So that means that we need to be doing a lot of preparation right now to be ready for that. So today's conversation is part of that work. And so again, thank you all for being here. So without further ado, I'd like to welcome up our first speaker, RN Cathy Fairbanks with the California Nurses Association.
I'm going to take my mask off. Thanks, Max. Hi, everybody. As Max said, my name is Cathy Fairbanks, and I'm a nurse at UCLA. I covered up my UCLA thing with my name here. But I'm a longtime member of the California Nurses Association, and I'm going to read comments about 5 to 10 minutes I'm going to speak, and then I'll pass back to Max, and you guys can get on with the real important work of this meeting. The California Nurses Association, as a part of the National Nurses United, is the largest and fastest growing union and professional association of registered nurses in the nation. It has 100,000 members in more than 200 facilities throughout California and nearly 225,000 nurses nationwide. It's really good to be here with you guys. I want to thank you all for coming. It reminds me of being a little kid and going to anti-nuclear campaigns with my mom. So this is like a very big thrill for me to be up here. It's good to see Assemblymembers Kalra, Carrillo, Santiago here. Thank you guys so much. As a member of a Democratic union, I appreciate seeing elected representatives here who are able to show leadership on important issues of justice, and I appreciate a willingness to engage in serious conversation with all of you, with them, on how to achieve the ends of healthcare justice. I want to give particular thanks to Assemblymember Kalra, who is our CalCare author, and our union has been working together with Assemblymember Kalra's office to organize these CalCare town halls across the state because we know it's crucial to have these kinds of conversations with our communities so that we can prepare to advance CalCare next year. Assemblymember Kalra, we thank you for your continued leadership and dedication and your time. I want to thank everyone else who's also here, nurses, community members especially. We're part of a movement fighting for true healthcare justice. The fact that we've gotten as far as we have is thanks to the tireless and dedicated work of our grassroots movement. That's you. And I know there are a lot of people in this room who have given a lot of time and a lot of energy and a lot of labor and a lot of love to this struggle. Thank you for what you do. Thank you for being here. I'm proud to be a part of this movement, and I'm proud to be a leader in my union, and I'm super proud to be a nurse. I've worked as a nurse for almost 18 years. I started my nursing career in San Francisco at a non-union hospital, and I've worked for the last nearly 13 years at UCLA, serving in the medical ICU, which is an ICU of largely chronic disease patients, and on a hospital-wide rapid response team. I know the value of being in our progressive union, even within the time of my own nursing practice. The benefits we currently enjoy were fought for by generations of nurses before us. I don't want to forget them. And we ourselves fight to pass on a healthcare system that is more just and more equal for everyone. As nurses, we dedicate our careers to caring for others. We work tirelessly to ensure that people who come into our facilities get the support they need. The California Nurses Association is dedicated to extending that care to everyone, and that's why we continue to work tirelessly to build a just healthcare system that's here for everyone when they need it. As nurses, we never give up on our patients, and we will always do everything in our power to protect them. That's why we've been fighting for decades to ensure healthcare is a human right for all people, regardless of the ability to pay. And we will be in this fight for as long as it takes, but we don't expect that to take many decades more. It is past time for the U.S. to catch up with other wealthy nations and to build a proper healthcare system that places people and patients over profits. We need this for the whole country. We need this here in California. We have the opportunity to establish a world-class healthcare system here in this state. Last year, Governor Newsom said that if California were a country, we would be on track to have the 4th largest economy in the world. We can and should have one of the best healthcare systems in the world, too. It should surprise nobody in this room that currently we are falling well short of that. I could easily fill in the rest of our time here together with stories that my colleagues and I have experienced about the ways in which Californians are being failed. But I don't need to, because the truth is we all know. Well, we all know that the status quo is not working for too many of us. Sadly, I feel safe in assuming that everyone in this room, I speak for myself also, has either experienced for themselves or knows someone who has been hurt by the dysfunction in our healthcare system. We all know people who have put off getting care, or who have been denied care they need, or who have fallen onto hard times, or been pushed into poverty. Okay, so instead I want to focus on a positive vision. I want to talk to you about the positive vision for healthcare that the nurses of this state want to build with our friends and allies in every community in California, including those who work in Sacramento. Once we've talked about this vision, we will then talk about how to win it.